Hi, everyone. Welcome. I see we're right at the top of our hour. I'm going to first apologize for my camera. Doesn't seem to want to turn on, but I'm Lynette Coleman, Community Impact Director from the Connecticut office of the American Heart Association, and I'm excited to welcome you all to our workshop, Bridging Clinic to Community Linkages, the YMCA's Blood Pressure Self-Monitoring Program. We have a group who represent the YMCAs of different areas of New York joining us to talk about this program. And so without further ado, I'm going to turn it over to Paige Hughes.
Great, thank you, Lynette. Good morning, everyone. Thank you so much for having us today. Again, my name is Paige Hughes. I am the Director of Healthy Living at the Alliance of New York State YMCAs. And I'm joined today by three of my partners in crime that have really helped advance this work throughout the state. So I'm going to pass it over to Joanne to introduce herself.
Hi, good morning, y'all. Good morning to our colleagues on the phone and on the Zoom. I'm Joanne Donnelly, and I'm consulting to the New York State Alliance of YMCAs on the blood pressure self-monitoring program after more than 20 years in 5 large metropolitan local YMCAs, including New York City, where I started working with Paige very closely. I've recently joined the National Association of Chronic Disease Directors, NACDD, as a public health consultant. And I'm going to pass to my colleague, Michelle.
Good morning. My name is Michelle Graham. I am from Watertown, New York. I oversee all of our healthy living programs at the Watertown Family YMCA. So I have the privilege of working with some amazing community partners, really to advance all of the healthy living and evidence-based health initiatives locally. I'm going to hand it over to Jess.
Thanks, Michelle. Hi, I'm Jessica DeRoge from the YMCA of Central New York in Syracuse. I am the Association Director of Health Strategies now. So kind of just like Michelle, overseeing all of our evidence-based programming that we can offer to both our YMCA members and to our community partners and community members. So I'm excited to be here.
Great, thanks, Jess. So I wanted to start this morning by just providing a high-level overview of the direction of our conversation today. So we're going to start by talking about the evolution of community health at the YMCA and why we're here speaking to you today about hypertension efforts. We'll then do a deep dive into our model of the blood pressure self-monitoring program. And then I'm going to pass it off to Michelle and Jess to give us some of those on-the-ground insights about how they are really rolling out this program and building capacity to lower the rates of hypertension in their areas. And then we're going to leave the conversation with just a small discussion about where do we go from here? What else can we do collectively as partners to advance this work across the state? So to frame up today's conversation, I wanted to start by providing just a little bit of information about the Alliance of New York State YMCAs, which is my organization. Many people are familiar with their local YMCA, but they don't necessarily realize that there is a statewide association of Ys. So the Alliance of New York State YMCAs represents the 37 independently incorporated Ys across the state of New York. You can see on your screen there to the right, each of those bubbles represent one of those independent YMCA associations. And in addition, within that 37 YMCA sites, we have about 140 branches and facilities ranging from summer camps to after school sites, men's residence. We really run the gamut as far as our reach across the state. And the Alliance started as the advocacy and public policy arm of the YMCA, but we've really grown our team and our portfolio over the last few years to really provide a variety of direct services and supports to our local Ys. So that includes things like board governance, strategic planning, fundraising. Again, we really have grown to offer a variety of different direct supports to our Ys. So to kick us off, I'm going to pass it back over to Joanne, who's going to lead us through a conversation about the evolution of community health at our organization. So Joanne.
Y'all, does my mic sound okay?
Yes.
Because Paige, your mic sounded super crackly to me, but as maybe it was just me.
Okay.
So you guys can hear me okay? All right. If something happens, just wave at me or whatever if I start to freeze. So to my colleagues, my Y colleagues on the phone, a lot of what I'm going to say is not going to be news, but I do want to just level set for some of the folks on the phone who may not be as familiar with the YMCA and why we are here in this space. So, you know, the origin story of the Y, and I love those superhero origin stories. The origin story of the Y, you know, built into the DNA of the YMCA, as we like to say, is a responsibility to respond to urgent social need. And that started way back in 1844 when George Williams, who was a 21-year-old drapery shop owner in London, noticed that the young men who had transplanted from agricultural jobs into the city of London during the Industrial Revolution were suddenly being tempted by many alcohol and prostitution and things like he did not want his staff to be involved in. So that was the formation of the Young Men's Christian Association. George Williams saw a need in his employees and formed group-based Bible study over his drapery shop. And that is actually how the Y got started. So he was able to provide them what he thought was a clear path towards healthier living with group support. Sound familiar? And that has continued, right? So into World War I in the United States, President Wilson asked John R. Mott to go over and support the troops. And he didn't give him any marching orders other than go over and support the troops and find out what they needed. And literally YMCA volunteers went over to Europe and asked the troops what they needed. And so as a result of listening to the troops, they built Louisville Slugger factories so they could play baseball while they were off the front lines. They built a couple of donut shops in Europe, and you can see pictures in the Y archives of the Y donut shops because the troops missed donuts. And it was just, again, responding to need. And actually, John R. Mott won a Nobel Prize for that work. And then the 1960s and 70s and 80s in the United States, as healthcare got better, public health got better, people started to live longer and have longevity. Chronic disease started to become more frequent as we started to live longer. And healthcare really was designed and still is designed to meet urgent need and not preventive needs. And so, you know, the YMCA got involved in fitness in the 1970s. We invented step aerobics at a Y in Maryland. As women went into the workforce in larger numbers in the 70s and 80s, the Y put after-school childcare program into place to prevent kids from going home alone. I was one of those latchkey kids when I was 11, going home alone by myself. And fast forward in 2003, researchers from the NIH approached the YMCA in Indianapolis and said, hey, we have this data that show that a lifestyle intervention is way better at preventing diabetes than a drug intervention, but it's really expensive. And so we really want to translate it into a group setting and see if we can cut the cost. So the YMCA of Indianapolis did that. They translated the lifestyle intervention of the NIH trial into a group-based program, which is now known as DPP. And in the meantime, the Y put its own unique footprint onto that program. And our two people on the phone with us today are great examples of that. Just this ability to provide ongoing support, empathy, tenacity, and creativity with how we work with people at the community level. So if you look at the last 2 decades, you know, the swim and gym of the Y from the 70s and 80s has really been transformed in terms of expanding our presence and helping people manage chronic disease as folks live longer and as healthcare still primarily addresses urgent care needs and not day-to-day lifestyle behavior change and intervention, something we've been doing for a long time. The slide. Can you guys still hear me okay? It says my connection is unstable. So here is the WISE Healthy Living Framework, and there's going to be some folks on the call who recognize this. But as we look at the last 2 decades in the YMCA, there's been a real commitment to a public health, healthy living framework in terms of thinking of our work and how we serve individuals, families, and then organizations, communities, and then social impact. So that's across the horizontal axis. And then also down the vertical axis, really being able to think of our work as something we've always done in terms of promoting wellness. But then as we got in more into the chronic disease space, how we're reducing risk from a secondary prevention perspective, and also how we're helping people reclaim health who have already been diagnosed with some type of medical condition. And that's where blood pressure monitoring fits in. And you can see there's some really, really important advancements here. You know, I'm just going to say the YMCA was the institution that produced the results that created the Medicare coverage for DPP. And I've been on presentations where other providers of the DPP have not acknowledged that about the Y. So every time I have an opportunity to acknowledge it, I will acknowledge it. It was us. Okay, next slide. So as I wrap up here, this is just, you know, this is the pipeline, the National Evidence-Based Health Interventions for the Y. This slide was created pre-pandemic, and I think my colleagues on the phone are going to tell you that this, we call it the swimming pool with all the different lanes of the programs. This pool has a lot less water in it than it did pre-pandemic. YMCAs across the country were closed for months on end. Their facilities and their membership base, which is a huge part of revenue streams, were greatly impacted. On the flip side of that, Ys did pivot. So again, back to this theme of social need, YMCAs did pivot across the country to providing food access, food delivery, emergency childcare for healthcare workers. A lot of the YMCAs were doing some of that work already, and now they're committed to trying to sustain some of this work. And again, that which really kind of fits under the framework of social determinants of health. In terms of the evidence-based health interventions, you're going to hear Michelle and Jess talk about their commitment to this work and how they've really tried to, you know, maintain as capacity as best possible through the pandemic. So I'm going to pass it to Michelle first, so she can share with you her. Oh no, wait, I'm going to Paige, right? I'm going back to Paige. So Paige is going to introduce the WISE blood pressure self-monitoring program and our involvement in it. I'll just finish by saying we were part of the Million Hearts campaign and one of the partners in the Million Hearts campaign around Check It, Change It. So Paige, I'm going to pass it back to you.
Great, thanks, Joanne. That's like the perfect segue to my next slide. So the YMCA's blood pressure self-monitoring program, like Joanne just shared, was developed by it was based off of the American Heart Association's Check It, Change It program. And YMCA of the USA, which is our national organization, engaged a pilot of 10 YMCAs to implement this practice of self-monitoring blood pressure. And what they found were some really key results that were really life-changing for a lot of the participants. As Joanne said, in 2015, the YMCA joined the Million Hearts Collaborative, which I think was really critical in propelling us forward when you took a look at the work we were doing to try to bridge the gap between the clinics and the communities and also facilitate those bidirectional communication pathways. So the YMCA's blood pressure self-monitoring program was really developed to provide that 4-month evidence-based approach that was giving participants the ability to understand those key elements of self-monitoring their own blood pressure, combined with that individualized support through Healthy Heart Ambassadors, who are our program facilitators, and then really rounded out with monthly nutritional seminars and education that was really key to maintain these lifestyle changes. So, to accelerate this idea of self-monitoring blood pressure, the research is there, right? We know that if a participant is able to self-monitor their own blood pressure twice a month for 4 consecutive months, they will see significant changes in their systolic and diastolic blood pressure. And again, to accelerate this, the CDC chose 3 organizations to essentially develop these cross-sector care models and really try to figure out what's the best way to offer this intervention for those with hypertension. And those 3 organizations were the YMCA, the National Association of Community Health Centers, and the Association of State and Territorial Health Officials. So from January 2017 until June 2018, the 3 organizations really worked together. It was a collaboration of 9 community health centers, 7 local YMCAs, and 8 local health departments in Kentucky, Missouri, and New York. And their role was really important in being able to design, test, and implement these collaborative approaches of how to lower hypertension rates. And you'll see on your screen, this was the graphic that was developed because each partner was really intentional about the role that each of them played in this process. So the center box that's highlighted for you on your screen, this is where the YMCA comes into play, right? We're not licensed professionals, but what we are really good at is change management and lifestyle modification. So again, this project, as well as many other initiatives that we've been fortunate to participate in, I think we're really critical in reinforcing why community-based organizations like the Y need to have a seat at the table when it comes to improving health outcomes and overall just connecting those dots between the clinicians and their community partners. So I also want to mention that our work in New York, specifically with the YMCA, would not have been possible without the generous support of the New York State Department of Health. So for the last 4 years, the New York State YMCA Foundation, which is the sister organization of the Alliance of New York State YMCAs, has received a number of grant dollars to essentially build capacity and scale this work statewide. And this multi-year funding, we're currently in year 4 of 5, has allowed us to do a lot of different things, from training and recertifying our staff, to building capacity. Right now we have the program offered at 10 YMCAs, and we're hopefully onboarding 2 more by the end of the year, creating referral pathways, and also looking at some really neat pilot projects about how we can integrate multiple evidence-based health initiatives to be able to recruit participants, retain them, and ultimately sustain the program for the future. So we're really grateful for the support. And again, without the Department of Health, I don't think we would have been able to build as much momentum for this program as we have in the last 4 years. So I'm really excited now to pass it off to 2 of our local YMCAs who are going to provide that on the ground perspective on how this program is really impacting their participants in 2 very different areas of the state. So without further ado, I'm going to pass it off to Michelle Graham from the Watertown YMCA.
Hi, Paige. Thank you so much. So both Jess and I really took a look at really what our counties look like. So you can see before you kind of our racial makeup here in the North Country, 88% white or Caucasian, African-American, about almost 6% Native American, 0.5%, almost 1% Asian, Pacific Islander, quite low, other races 2%. So our prevalence of hypertension in our area is actually relatively high. We're at 44.2%. We know that our providers are aware of this. One of the key things for us is always making those internal connections with providers, and we have many. However, that referral pathway really that Paige just talked about has always been tricky. It's always been a barrier for us, but we did find a great provider locally, and I'm going to highlight her in just a moment. So our YMCA is made up of 4 branches. Watertown, we have 2. We have a couple outliers in Carthage, New York, and another in Sackett's Harbor, and we have a standalone daycare facility. We're about a $6 million operation. In a typical year, our pre-COVID membership rates were about 10,000. Now we're holding steady at about 7,200 to 73. The collaboration that I really want to highlight today is with the North Country Family Health Center. They're an FQHC. I went over there in early April. I presented to all of the providers. Unbeknownst to me, they had a new provider join their practice in January who was really all in. Michelle, we're going to trace back. We're going to see who we have that has high blood pressure, who we have that has or is at risk for type 2 diabetes. And one of our goals is, once you can get individuals into your facility, then we can touch base and we can direct them in other ways. So, once we can get them in, whether it's for high blood pressure, the diabetes prevention program, whatever it is, we can almost always connect them to other programs. And I think something that the Y does really, really well is we connect people. And not only are we connecting them internally to our space, but we can connect them to other things that are available in the community as well. So like I said, we had some inroads with this FQHC and this amazing provider. So our referrals into the program have been pretty slow, quite frankly. And once she started referring to us, and this number has actually changed since this slide, I'm more like close to 40 and probably more like 15 enrolled. And that may not really seem like this huge number, But within a 4-month span, from getting no referrals into the program to now really getting a regular referral stream from this FQHC is really pretty remarkable. And the connections that we make with them. And once somebody buys into the program, they really truly buy in. So, although the number seems relatively small, I think making this partnership and really sustaining the partnership says everything, about our growth in the future and how we can really help those in our community that are at the greatest risk. This provider also refers steadily into the diabetes prevention program. Next slide, page. So just like I said, we are getting some of the most vulnerable patients or participants that come into the program, and they are at risk or have many comorbidities. And we get this great opportunity to really share this space and share our facility with them. Like I said before, connecting the dots and getting them connected in other ways to improve their overall health status, I think is really, really key. Our feedback loop, or I want to say our complete loop, if you will, really starts with the referral. Once the patient starts the program, I send out a note or a fax back to the patient, and then they're notified of, of course, ending the program or completing the program. I love these individuals that come in and I get to sit one-on-one with them. We switch directions just a little bit with how we offer the program. I certainly block out time still, but because of COVID and not wanting people to overlap, I kind of I schedule individuals to come in during a certain period of time. And that's worked out really, really well. Of course, some of these patients need a little bit of, reminder like, hey, I haven't seen you in a while. And, they're really quick to really get right back on track with participating. But completing the loop is a really key critical component of sustaining these relationships, because these providers want to know that their patients are actually participating. I've seen, some of the participants come in who had uncontrolled blood pressure, and then they're going back to the provider with a list of, all of their blood pressure readings, and then they're put on medicine. And isn't that some of the reason why we're sitting in this space, right? We're really trying to improve the health and well-being of those participants. And then they find out, hey, I need medication, and they're okay with that. When they're really committed to the program, they're really committed. And like I said before, these individuals may qualify for some of our other programming, whether it's through scholarship or membership, DPP, enhanced fitness, other high-level evidence-based health programs. I think connecting the dots is one of the things, like I said before, that we do extremely well at the YMCA. I think this program is important. Of course, I'm highlighting successes. Our next slide will showcase some of the barriers. Paige, feel free to slide it forward. Obviously, not every referral participates in the blood pressure self-monitoring program, and that's okay. Sometimes if people aren't ready, at the first call, then I may hear back from them, or I may get another referral from that provider 2 or 3 months down the road, and then they're ready to participate again. We spend a fair amount of time reaching out to patients that will obviously never call us back. That wheel is continual, but we know we have to do it. In Watertown, I'm a one-girl show. I really don't have anyone else helping me with any of these programs. However, I feel like I'm the luckiest person in the world, right? I'm doing great work that I'm super passionate about. Getting other providers to understand the value and what the YMCA has to offer is a barrier. Obviously, we need payment for services rendered. The program is currently grant funded and will not be free forever. Our participants coming from the FQHC could not afford this program otherwise, and attendance sometimes can be difficult. Frequent calls are necessary to enhance program participation. On my last slide, I just have a quick video from my provider that has been really a godsend to our local YMCA.
Good morning, Dr. Jane. If you could introduce yourself and where you are in practice. Michelle has a couple questions for you.
Good morning. Thank you for joining me today. We are so grateful for our collaboration that we have established the North Country Family Health Practice Clinic and the YMCA. If you could share with us today why you think this collaboration is so important and how it's benefited your patients, that would be amazing.
So I practice internal medicine as well as pediatrics here at North Country Family Health. And one of the largest or most frequent diagnoses that I have here is hypertension or elevated blood pressure without formal diagnosis of hypertension. And we know that patient participation in their own healthcare is essential for continuity in medication administration and as well as improving outcomes. So home blood pressure monitoring with a cuff that's accurately measured is very important for blood pressure control and prevention of negative outcomes like heart attack and stroke. And so having patients educated about how to use a blood pressure cuff and what numbers are acceptable, and in addition to that, other lifestyle changes that can be made through programs such as What's at the Y to help lower blood pressure through exercise, dietary changes is also essential, not just taking that medication. Having the extra data, and I tell my patients I love data, is really important in monitoring their blood pressures, making changes in blood pressure medications. And so I give them all homework to check blood pressures at home and to return to me with their recordings and their machine to make sure that it's an accurate measurement. So it's been invaluable to have the YMCA program give some of our patients blood pressure cuffs who can't necessarily afford that, and also spend that time that I may not have to educate them on contributions to high blood pressure, impact of high blood pressure, and the importance of taking medication on a daily basis if that's been prescribed to them.
Perfect. Thank you so much for your time today. We are so grateful for this collaboration.
Good morning, Dr.
So Jess is next. I'm going to hand the baton over to you. Thank you so much.
Thank you, Michelle. I just wanted to reintroduce myself. I'm Jessica DeRoger with the YMCA of Central New York. And just like Michelle's first slide, just wanted to kind of give you a good picture of the Central New York YMCAs. And we have, so it's a pretty good sized county in the middle of the state. And you can see our breakdown of our communities, majority being white, non-Hispanic. And then closely behind is our Black African-American community, followed by our Asian or non-Hispanics. Michelle has a higher rate of hypertension. We aren't far behind, which isn't a awesome thing to admit, but it's 34%. So we knew right away that this was a huge need in our community that we really needed to tackle as a YMCA. We have a really good reach across our county. Being that it's a large county, we do have 7 branches or 7 facilities in our county, kind of at all points in different areas of the county, so that way we can serve various communities. Pre-COVID, we were a $25 million operation, and I kind of can show you the pre-COVID numbers there, a little over 60,000 members. And we're currently just about halfway there, and we're still climbing, but it's been a slow climb. And I just wanted to point this out is because, like Paige had mentioned in the introduction, is that WISE took a huge hit in the pandemic, and we did have to close our doors given our state rules, and reopening has still been a challenge. And we're seeing our members, our nice, loyal, faithful members come back, but we're not, as you can see, we're not near where we were before. So, we took a huge loss. I know I can speak for our YMCA. In 2020, we did take a hit of $10 million. And that's a really big number for an organization that is supposed to serve the community needs. And we do that already on a shoestring budget. And so to kind of go into a 2021 already kind of under and railing from 2020, we've been really fighting and trying to keep this work going. So just a little side note, you can see that last bullet. Who opens up a facility in the middle of a pandemic? Well, we thought that was a great idea. So we did a partnership with St. Joe's Hospital and a couple-year study serving a really high refugee New American population in the downtown area of Syracuse. And we opened a women's only wellness center space, which is meant to serve that high refugee population that is not, they're not really, their religion permits them from exercising or being in the presence of men without their appropriate religious head coverings. So it was really meant to serve that need of that women. And, we're 8 months in or so, and we're really finding that it's serving a need. There's much, much more work we have left with that facility, but we're just really scratching the surface. Next slide, please. So I did want to talk to you about a unique partnership that we have, kind of like Michelle has one with an FQHC. We've found a really great partnership with Syracuse University. I think most people have heard of this place, but really what we discovered with them and working is that they're a self-insured payer or self-insured employer. And they really wanted to be able to offer their employees more health programming, reduce healthcare costs on their end, increase productivity at work, and really invest in their employees. So we established this neat relationship in that Syracuse University pays for the program, but what they do is they deduct a small amount out of each employee's paycheck as the program goes on. However, they reimburse that as the program goes on for benchmarks that the participant meets. So things like, are they attending their appointments? Is their blood pressure being reduced? Just again, overall adherence to the program. So at the end, the employee really invests nothing if they do meet all of the program requirements. And so they pay nothing, and Syracuse University is really footing the bill. But what we've discovered with this kind of payment model, and it was really unintentional going into it, was that the retention of the participants has been huge, almost 100%, unless something, out of our control happens. But they're staying in the program, so which in turn we know sees better results in reducing hypertension for them. So I'm really looking at expanding this in Central New York. So whether there's someone listening on today, or of another employer or community organization that would like to kind of replicate this model, I think it's super effective. We're willing to work and make this model fit within any employer's organization. So how we were able to deliver. So let's see, 2020, I got to think back, the world shut down and we were actually in the middle of some of our delivery of BPSM. And one of them was with Syracuse University as our partner. And we kind of quickly, probably within a matter of 2 weeks, managed to pivot. We didn't want to lose their employees who were already engaged in BPSM. So we, without any sort of guidance, any handbook or anything, we just shifted to a virtual delivery. And at that time, I think us and most of the world was still kind of new to virtual delivery of anything. And we started to engage with participants via Zoom. We got them all Bluetooth enabled blood pressure cuffs. So we were able to get those picked up for all of them. And that Bluetooth cuff allows our facilitator to see all of their readings, right? So we were able to see them face to face, but we could still download all of their readings for the program. So this was kind of neat. And we have since learned that, again, this program gave us great results, high attrition in the program. So now we're able to replicate that. And the neat thing is that people over the last 18, 20 months have really obviously gotten into virtual, and that's kind of how we're communicating these days. So we're seeing that they're showing up. It's kind of like life doesn't get in the way anymore because you have that ability to kind of jump on wherever. So we're really loving the fact that we can now offer variety with the program. We don't have to say it's only face-to-face and you have to drive to X, Y, and Z place. So it's been a really great addition to the program and allowing us to get much better results. I think that's it. Oh, yeah. So I'm going to turn it back to Paige, but I definitely thank you for allowing us to be here and sharing our program, and feel free to ask questions at the end or reach out to myself or Michelle after this program.
Great, thanks, Jess. So where do we go from here? Joanne and I are going to tag team this one, but I'll let her kick it off as we start thinking about sustainability and how do we keep the momentum going with this program, but in a way that's cost effective for both the YMCA and the participants. So Joanne, you're on mute.
What do we want to do? Do we want to open this up for everybody? Because I want to be mindful of time. We have to be done by 10:45, correct?
Yes, we'd
Yeah.
like to be done by 10:45, just so everyone can make an easy transition to our
Okay.
final views. I have the chat feature open, but if you're ready for
Okay.
live questions, please, anyone use the raise hand feature or pop yourself right off of mute. We'd be happy to take your question.
Yeah, because I think we've got some folks on the call who could also potentially weigh in on some of these. So, I think we just want to end on how we move forward with this program around sustainability. I think all four of us, and particularly Jess and Michelle, have been able to sort of highlight some of the opportunities and challenges related to sustainability. And they've changed somewhat pre-pandemic versus some of the silver linings of COVID around the flexibility of a virtual model. So, thoughts on how we might sustain the service. So we have some internal opportunities to think about, and we also have some external opportunities to think about. From an internal perspective, we were coming up with just what are those buckets in terms of opportunities and challenges. And the buckets that we brainstormed were, capacity. So just what is the capacity of the Y right now to continue to, maintain and build these programs. Obviously, Paige touched on the fact that grant funders right now are providing much of the dollars to make this happen. So that's something for us to think about. And program models, Jess also touched on this, like she has gone remote and virtual with this program. And what we've seen with Jess and otherwise across the country is actual increase in retention in the program with the convenience and support with a virtual model. And then just some of the so what are the implications for technology? So, I'm just going to throw it out to Jess and thought that you have on any of these internal, let's call them opportunities, as we think about sustainability. Focus on internal first.
Yeah, so I mean, we always at the Y always have to think about sustainability because this work, it does come with a cost, but we also don't ever want to engage in any work that we can't continue to do to the community because we don't want to start something and not be able to continue to deliver it. So sustainability is always something we do think about. I know I can speak for the Central New York Ys is that we do have great leadership that really supports this work. So we generally try and incorporate it into our overall operating budgets. And what does that mean? It means, like most of Y programs, is that we rely on support from our community, donors, and much of our fundraising efforts. So we do really focus on that and going out to our community partners and, obviously asking for donations and support specifically to programs like this.
Really the same here. My CEO comes from healthcare. So having her support behind this is certainly a critical piece here in Watertown anyways. But bigger yet, like, could insurance companies donate blood pressure cuffs? I think we have to continue to think outside the box if we're going to continue with this model. Charging for it, like I said, especially with the clientele that I'm working with, they would never be able to afford it, but we know that we're making progress based on the results that we have. And I saw that came up in the chat. How are you tracking? Well, we track in an online data resource place called RedCap. So we can really evaluate the efficiency, effectiveness of the program there. And I can tell you, firsthand, really what my results look like. And, across the board, we're decreasing hypertension rates with our groups. And I think that that's really the critical piece. Have we written any literature? I think that came up, or have we written anything about this? I'm guessing not to date. We're certainly collecting lots of data at this stage of the game, being part of this project, and we'll continue to really monitor and, obviously change course as necessary.
Yeah, just a real fast piece on the evaluation, right? So in the initial pilot rollout and translation from Check It, Change It to YMCA delivery, there was a pilot study just to see if we could produce similar results to what was in the literature. It was done with 7 YMCAs. I want to say it was in 2015. And so the Y was able to replicate and get similar results to the literature that was on the program. And that's when they began rolling out and piloting. What has not happened that happened with DPP was a very, very, the translational research was published and a follow-up was done, and then of the DPP, which the YMCAs were the organization. And so there hasn't been that level from the YMCA's perspective on the evidence, but the Y did move forward and replicate on the original evidence published in the literature on this program model, if that's helpful.
Joanne, I thought that was very helpful. And unfortunately, I think you blipped out on one key piece.
Yep.
So I'm just going to ask you, just for the sake of making that last connection you were making, about which piece exactly didn't the Y move forward with more deep on a white paper or
Oh, just you know, when you look at DPP, it's been, you know, it's been highly published, right? So the translational research that the Indianapolis Y did was published in 2008, but that was because the NIH researchers, you know, were involved in that translational research. And so they did publish a paper in 2008. And then of course the CMS innovation trial, right? Those results were widely disseminated and pulled the trigger on the Medicare benefit. So, you know, but when the Y was able to demonstrate capacity to pilot and scale and disseminate these evidence-based programs, when they decided to move towards blood pressure as part of the Million Hearts Initiative, there was the initial research on that program model. The Ys engaged with about 7 YMCAs to see if they could replicate and get similar results, just like Indianapolis had done with the NIH trial. And the answer was yes, which is why they moved to pilot form. But you know, I can tell you that the capacity of YUSA right now to drive national research projects has been greatly diminished through COVID, just like local Ys have been impacted.
Joanne, thank you for following up on that. I really appreciate it. And I think you all have been doing such a great job in answering the kinds of questions that are coming into the chat. I am going to ask a question as someone who's collaborating with my local Y, who has BPSM, and we are excited to have one of our local clinics are being able to do, based on DPP, we have that system set up for EHR. And I was just wondering if you just go back and talk a little bit more about making that one-on-one connection, or how AHA can, or organizations like ours who might be on the phone, can make those connections to the Y. What would you like to see us come to the table with so that we can be equal partners?
So for me, I love collaborating locally, you know, no matter what the case. We collaborate with the American Heart Association with a 12-week fitness program. We've always welcomed them into our walls, our YMCA, free of charge for the Better You program. So I would love to collaborate on a greater level to really spread the word about increased dissemination of this particular project. You know, is it just about BPSM? You know, today it is, but really what we have to offer on a large scale is so much bigger. And I think when everybody's at the table, it just strengthens the community to a greater extent.
That's very well said, Michelle. Anyone else?
I would add from the statewide perspective. So we recognize that not every community has the presence of a YMCA. And knowing that, I think the silver lining to the pandemic was the ability, like Jess showed, to have a virtual program offering. So I think something that we encourage and we certainly welcome are if there are other statewide organizations or partners that are interested in getting involved with the program, or even just, you know, working on a referral system, connecting with the state alliance, because then we can triage you either to your local YMCA's program, or we're in the process of piloting our own virtual delivery to kind of facilitate those gaps where there may not be a Y. So I think we're really open. I think this program works really well when those partnerships exist. It's just kind of having that initial conversation and talking about ways that we can kind of maximize our talents together.
Yeah. You know, just to piggyback on Paige, you know, one of the great advantages of the CMS study and the 17 Ys that were in that study is, you know, clinical referral partners were incentivized to refer people into DPP. And so when I got to the New York City Y and they were in the middle of the CMS study, they had hundreds of referral partners for DPP that were part of the CMS study. One of the biggest challenges that YMCA has had is approaching clinical providers and understanding exactly who needs to know what we're doing and who can execute on a referral. We, always think it's the doctor, but sometimes it's not the doctor. Sometimes it's the nurse manager or the case manager. So knowing exactly who needs to know about the program and who can actually pull the trigger on that referral. And then, of course, the data systems to be able to receive that referral and communicate bidirectionally. That's something the Alliance has been working on. But knowing exactly who to talk to at these clinical providers has been really challenging sometimes. And you can see when you do hook one like Michelle did with Dr. Jane, when you have a physician who understands, okay, this is about better self-monitoring. It's about the conversations that the Y coach can have on a regular basis with this participant who understands that this is not just about checking your blood pressure, but being mindful about what is happening in your life that is changing those numbers up or down for the better or for the worse. And then also being able to come to the Y and exercise and do other healthy behaviors that support you managing your blood pressure. We need docs who understand.
That was heartbreaking.
Did I freeze again?
Yes, go ahead,
Oh my
Joanne.
God. Once we find a couple of those physicians, it's so critical to being able to enroll more people. So I'm sure I'm freezing on all the most important points I'm making, right? But yeah, sorry about that, y'all.
No, that was an incredible way for us to wrap up our session with our colleagues from the Y. We are so appreciative of you coming on and telling this story. I am encouraging everyone in the audience who, like me, will go right to my Y Alliance partner member and start the conversation and play Joanne's piece about how we get to those right connections at our health centers and in our organizations like the AHA. So I thank you all again. You'll receive surveys. You'll also receive any slides and transcripts from this workshop. We encourage everyone to log off. I'm going to stay on a few moments for anyone who might have problems getting back to the main session. I'm here to help, as well as some other folks from AHA IT. So Y colleagues, thank you so much for joining us. I really appreciate your time. Everyone have a great weekend. Thank you.
Thanks, Lynette. Thanks, Joanne. Thanks, Paige.
God, I'm gonna throw so was it really bad? How much did I freeze?
No. You were great.
Get a booster though, Joanne. Get a booster.
I do have a booster.